For the first time since his cancer diagnosis, we're now hearing from former President Joe Biden. In a post alongside his wife and their cat, the 46th president this morning thanked his supporters for their love, saying, quote, "Cancer touches all of us," and adding, "We are strongest in the broken places." His personal office announced over the weekend he was diagnosed with an aggressive form of prostate cancer that they say was found just days ago and that it had spread to his bones. Biden, who's 82, and his family are now said to be reviewing the treatment options. And here to talk more about all of this is oncologist Dr. Tiffany Trosso-Sandoval. Doctor, thank you so much for being here with us. As an oncologist, of course, your task is to treat cancer. I'm curious what you think about this particular cancer diagnosis for the former president.
Yes, well, thank you so much for having me here. And I just want to start by telling the president and his family how very sorry I am that they have to go through this, particularly at his age. I know how much chaos and confusion and fear follows a new diagnosis of cancer. This particular cancer is very aggressive. It's a Gleason score 9, which means that two parts of the cancer are evaluated in terms of how aggressive they appear under the microscope. So the higher the number, the more aggressive that the cancer is. And this one in particular does appear to be aggressive. What's also unfortunate is that it appears that the cancer has spread to the bones. So that makes this metastatic or stage 4 cancer.
And so we know those details as you lay out there. And then we got this other piece of information that this is hormone sensitive cancer. What does that mean?
Sure. So prostate cancer is very much driven by testosterone. And so a hormone positive prostate cancer is how they normally will start. And therefore, treatment is often based on getting rid of those hormones. So it's called androgen blockade. And so we basically will give medications that will shut down the production of testosterone as well as block any other testosterone in the body from getting to the prostate cancer cells. I often liken this somewhat, it's not exactly the same, but to women that have breast cancer that will get perhaps a Lupron injection, for example, to shut down their ovaries and put them in menopause. And then they'll take a drug like tamoxifen, which will block the estrogen receptor from getting any residual estrogen in the body.
Okay. And listen, I think people do have some questions around, okay, well, how did it, get discovered at such a late stage? Was there screening that could have been done? But the guidance on screening for prostate cancer in men over 70 is kind of surprising. Walk people through what you are supposed to do and the nuances around that.
Well, that's a little difficult. It's tricky because there are a lot of nuances to it. And
Right.
so one body of evidence says that we shouldn't screen after 70. Some say that you screen between 50 and 69 and that all screening should stop at 75. A lot of what is done in traditional practice is on a case-by-case basis. And so oftentimes patients will be getting PSAs, maybe not as regularly as they should, because there is no standard recommendation. But particularly when a patient would present with a symptom, such as changes in their urinary frequency or their habits, that would should prompt someone to check a PSA.
Yeah. All right, Dr. Tiffany Trosso-Sandoval, thank you so much for adding some context around this. I really appreciate it.
Absolutely. Thank you again.
Thanks.
Nearly 10 years after losing his son Beau to brain cancer, Joe Biden announced his own cancer battle. The former president was diagnosed with what his office described as an aggressive form of prostate cancer that has spread to his bones. Today, he posted this picture with the message, "Cancer touches us all. Like so many of you, Jill and I have learned that we are strongest in the broken places. Thank you for lifting us up with love and support." CNN's Arlette Saenz joins me now. Arlette, you have covered the former president for many, many years. You know him and the people around him very well. What are you hearing from your sources about this diagnosis and the sort of headspace of the former president?
Well, Dana, former President Joe Biden is at his home in Wilmington, Delaware today as he and his family are currently trying to work through what the next steps for treatment will look like. That is a conversation that they are having with the physicians they've been consulting since he was diagnosed with an aggressive form of prostate cancer that has spread to his bones. Now, to provide some timeline, last Monday, a spokesperson for Biden had told me he was being evaluated after a small nodule was found in his prostate. The statement that was released yesterday by his personal office said that the former president was experiencing increasing urinary symptoms, and then it was on Friday when doctors delivered the news of the diagnosis. Now, we don't know exactly what treatment options they have presented to Biden right now, but medical experts have said that this type of cancer could be treated with things like hormone therapy, chemotherapy, or radiation. But certainly this very difficult time for the Biden family. Of course, they went through a cancer diagnosis when his son Beau Biden was fighting brain cancer and ultimately passed away back in 2015. One thing in the messages and support coming from many of his allies, they keep pointing to one word to describe Biden, and that is fighter. And that is something he and his family plan to do as they are facing this cancer diagnosis head on at this time.
Yeah, and after the report came out and the statement came out yesterday afternoon, one of his longtime allies said to me in a text that this was already going to be a tough week and now it's even tougher. Can you talk about that, this tricky political moment for the former president?
It is really a very complicated time as this news of the diagnosis is coming up. Biden and aides around him have started to face renewed scrutiny about his state while he was in office relating to his physical and mental capabilities. Our colleague Jake Tapper and Axios reporter Alex Thompson are set to roll out a new book tomorrow that details some of the signs of decline. So it's really raised a lot of questions, potentially casting a shadow on Biden's legacy, but raising questions not just for the former president and his aides around him, but we've already seen prominent 2028 potential contenders in the Democratic Party face questions about their handling of the 2024 election, whether Biden should have remained in the race or if they've seen any signs of decline while he was in office.
Arlette, thank you so much for that reporting. Appreciate it. And Vice President J.D. Vance weighed in on President Biden's diagnosis today while on Air Force Two, headed home from Rome.
First of all, of course, we wish the best for the former president's health. And, it sounds pretty serious, but hopefully he makes the right recovery. Like I will say, whether the right time to have this conversation is now or at some point in the future, we really do need to be honest about whether the former president was capable of doing the job. Whether it was doctors or whether there were staffers around the former president, I don't think he was able to do a good job for the American people. And that's not politics. That's not because I disagreed with him on policy. That's because I don't think that he was in good enough health. In some ways, I blame him less than I blame the people around him.
And my panel is back. Leanne?
Well, J.D. Vance also won the election, with Donald Trump. And so, yes, there are questions about President Biden's mental and physical capability when he was in office. But what this cancer diagnosis has also done on the right is it has renewed new conspiracy theories about what was going on in the Biden White House as well. I talked to some Democrats today, and I asked them some Democrats on the Hill, about how they are addressing this and thinking about this. And they tell me that they're actually not really talking about Biden at this point, that the fact that they are really trying to look ahead and look forward and not about the Biden candidate, his decision to run for president is not top of mind.
So we just played J.D. Vance, the president. President Trump put out the following statement yesterday. Melania and I are saddened to hear Joe Biden's recent medical diagnosis. We extend our warmest and best wishes to Jill and the family, and we wish Joe a fast and successful recovery.
Couple things. First of all, our hearts go out to President Biden. It's just an awful diagnosis to get just a few months after you've left office when you're going to retirement. So that's really hard. The politics of this, Arlette mentioned that it could cast a shadow on his legacy. I would argue that the shadow is already cast. His decision to run for re-election and the new reporting that's coming out, as well as a lot of the reporting that we've done already, is just going to be a big part of his legacy. And in some ways, it might be a way to kind of draw a line between those two things now, because I suspect Democrats are going to focus on trying to lift up and support Joe Biden and not necessarily cast shadows, or not to use that word a second time, but throw dirt on something that they're already pretty upset about, but maybe is not the most important thing right now.
Look, I mean, like most people who have been in public life, I mean, few have been in public life as long as he, 50 plus years. Legacies are complicated,
For sure.
The good, bad, and the ugly. He also, part of his legacy was and is the cancer moonshot. Trying to eradicate cancer. Worked on it when he was vice president after his son died, and continued it when he became president.
Yeah, and cancer research trying to eradicate, at least significantly reduce cancer diagnoses in this country was a big push of his. He named it after his son, Beau, of course, passed away from brain cancer. And tragedy is also part of Joe Biden's legacy, having lost a wife and his daughter in that tragic car accident during his first term senator. So he is not someone who's not used to tragedy. On the cancer research side, one of the big questions is going to be, will this funding survive this era of DOGE cuts? We've already seen some concerns that there's pullback, particularly the National Institutes of Health and the like. How much does that actually survive going forward? That's going to be a big question as well.
Yeah, well, we talked about this a little bit yesterday when the diagnosis came. He's always been one of the first people on the phone with either a staffer or a colleague when they get bad or tough news, or even the family member of or the staffer of that person he doesn't even know. And so I'm sure that is coming back at him in a very positive way. The universe is probably smiling on him in that small way right now.
And more now on our top story this hour. Former U.S. President Joe Biden has been diagnosed with what his office calls an aggressive form of prostate cancer. While a serious concern, this type of cancer can be treated and managed, and the Bidens are currently reviewing those options. A doctor who is not involved with Biden's case tells CNN that while there is no cure, new therapies can extend the lives of patients. And cancer has long been a personal issue for Biden. His son, Beau, died of brain cancer in 2015. President Obama tapped Biden in 2019 to lead a task force aimed at curing cancer, something that he later reestablished during his own presidency. In 2019, Biden spoke about his belief that a cure was within reach.
The fight against cancer, the fight to eliminate racial disparities in cancer and outcomes, is a fight we have to be unwilling to postpone. I am convinced, as we make significant progress in cancer, the only truly nonpartisan issue facing this country, that the rest of the nation is going to say, damn it, we can do anything. This is the United States of America. This is fully, thoroughly, totally, completely within our wheelhouse.
There has been an outpouring of bipartisan support on Capitol Hill following Biden's cancer diagnosis. U.S. House Speaker Mike Johnson called it sad news, saying that his family will be joining the countless others who are praying for the former president. Republican Congresswoman Marjorie Taylor Greene also offering prayers and saying, quote, "Cancer is truly awful. My dad passed away in 2021 with cancer." And Democratic Senator Elizabeth Warren writing on social media, quote, "Joe Biden has worked for years to advance the cause of beating cancer, and now we have his back in this fight." And Biden's health was very much in the news even before the cancer diagnosis was announced on Sunday. That's because of a new book by CNN's Jake Tapper and Axios journalist Alex Thompson. CNN's chief media analyst Brian Stelter looks at the controversy that the book is already generating ahead of its release on Tuesday.
The timing of former President Joe Biden's cancer diagnosis is certainly dramatic, coming on the eve of a blockbuster new book about his health and his time in the White House. That book is Original Sin by CNN anchor Jake Tapper and Axios reporter Alex Thompson. The book has been getting a lot of pre-publication publicity and buzz, as well as a lot of pre-orders. because of the damning new details it contains about Biden's time in office and his decision to seek re-election in 2024. At its heart, this is a book about mortality, about aging, about sickness, and it is framed by the authors as a tragic story. So we'll see if that has more resonance in the wake of this cancer diagnosis news. The book has also dredged up a lot of debate about Biden in the 2024 election. If you search his name on social media, you'll see what I mean. Many progressives defending Biden, saying that this is unfair to him and saying they don't want to hear about the past. Many conservatives saying they knew all along about Biden's infirmities and arguing there was a cover-up by the Biden White House. Now, it'll be interesting to see if this book is received in a new light now that this cancer diagnosis is public. I'm sure some observers will say that the reporting in the book is even more important now and that the diagnosis underscores the reporting. Others might say it's unwelcome or unpleasant and unfair for the Bidens. It is notable that nothing in the book should be surprising to the Biden family, since everyone mentioned in the book was asked for comment ahead of time. On Sunday night on CNN, David Axelrod said that conversations about Biden and about what the Democrats did in 2024 should be, quote, more muted now. He said those should be set aside for now as Biden is struggling through this health crisis. I've certainly seen others on social media making those same kinds of comments, and yet there are already conspiratorial ideas taking shape as well. Donald Trump Jr., for example, on social media suggesting that this is being announced now, this cancer diagnosis being announced now so that Biden will be viewed more sympathetically. So those arguments are going to keep going back and forth. And there are other books in the works as well. At least one more big look back at 2024 decisions is coming out this summer. So while the conversations may be more muted for the time being, they will still be taking place in the days, weeks, and months to come. Brian Stelter, CNN.
The latest on former President Biden's cancer diagnosis. The 46th president's office saying an aggressive form of prostate cancer that has spread to his bone was found just days ago. Biden, his family, his doctors are now said to be reviewing treatment options. Now this morning, Biden, who of course just left office about 4 months ago, addressed the diagnosis for the first time. He posted a photo alongside his wife, writing in part, quote, "We are the strongest in the both broken places." And with us now, Dr. F. Perry Wilson. He is a nephrologist and associate professor of medicine and public health at Yale University. Thank you so much for being here with us, Dr. Wilson. I first just want to ask you, again, we have that statement from his personal office yesterday. That's about as much detail as we've got. But what questions do you have about the former president's diagnosis?
Yeah, thanks so much for having me on, and certainly my best wishes to President Biden and his family. This is a tough diagnosis. Metastatic prostate cancer is not the most common way it gets diagnosed. Fortunately, about 3 million men right now in this country have prostate cancer. Only about 100,000 of them have metastatic prostate cancer. But the good news is there are quite a few treatments, and that's really where my questions to his team would be. What is the treatment plan? It sounds to me like they're going to do some hormone-based therapies at the very least, but will there be chemotherapy involved? Is there a potential for radiation therapy involved? I think hearing about those would be interesting.
Yeah, and you mentioned it is rare to be diagnosed with prostate cancer this advanced. Did that surprise you that was the diagnosis, that it was this far advanced?
You do this enough, you don't get too surprised. There's always outliers like this, and not everyone follows the traditional path. We've all seen cases of cancers that really do kind of spring up out of nowhere, particularly some aggressive cancers. One wonders if he was being screened for prostate cancer with PSA testing during his physicals. Typically, but not always, PSA levels are elevated in the case of prostate cancer. Even in metastatic disease, they aren't always abnormal. And some people would suggest that in older individuals, you don't even bother doing PSA testing. So it's unclear to me right now whether there was a hint of this before or not. I mean, from everything we've heard, it seems like they were somewhat caught off guard by this.
Yeah, and so I did want to ask you about that because the screening guidance for prostate cancer in men over 70 is that I believe they should not be screened routinely. Why is that the guidance? What are the caveats to that? What's the nuance to that?
there's a lot of nuance here, and it all boils down really to two things. One is the risk of false positives, which means you do the screening test and there's an elevated PSA, and that leads to more testing like biopsies, which are invasive, and it turns out you didn't have cancer at all. And that gets more common as you get older. The other thing is that you may have prostate cancer, but most men with prostate cancer, these 3 million who are living with prostate cancer right now, will not die of prostate cancer. They'll die of other things. And so there's a very good argument to be made that, if you're going to find this, but it's never going to cause you a problem, because the odds are that you'll die from something else, whether it's heart disease or cancer or some other problem. There's an argument to be made that it's not worth going through all the invasive biopsies and treatments and things like that. Of course, whenever you have a case like this, where it's easy to look back with 2020 hindsight and said, oh, if we had only been testing more frequently, maybe we would have seen this. We've all had that feeling, but of course, guidelines are designed for the population on average, not for each individual person.
Right. And look, we did get this piece of news that the cancer has spread to his bones, that it is metastasized. What does that mean, and how can what does that mean for how he'll be treated, and just kind of the long-term prognosis for him?
The prognosis is clearly worse once prostate cancer has metastasized. Most people with local prostate cancer that hasn't spread anywhere have 85% 5-year survival. I mean, it's very, very treatable. That does drop significantly once there is spread beyond the prostate to the bones, like it is here, with average survival time in the 3 to 5 year window. There's a caveat there, though. There's two types of prostate cancer that can spread this way. We call one hormone sensitive and one hormone resistant. His is apparently hormone sensitive. That opens up treatment with hormone blockers to slow the spread or even halt the spread, which improves the prognosis. So, clearly, we would rather not have disease that had spread to the bones. That's very clear, but there is some good news that it's hormone sensitive. That gives one extra avenue of treatment that is typically well tolerated and quite effective.
Yeah, and a nice silver line there for sure. Dr. Wilson, thank you so much. Really appreciate your expertise here.
Sure thing.
We turn now to former President Biden being diagnosed with an aggressive form of prostate cancer, an announcement that came over the weekend. Biden's office saying the cancer was found just days ago after the 82-year-old was having increasing urinary symptoms. His team also saying that the cancer has spread to his bones. Earlier today, Biden thanked the public for their love and support, writing in a post, quote, "Cancer touches us all," adding, "We are strongest in the broken places." With us now to discuss is Dr. Elizabeth Coleman. She's a medical oncologist at NYU Langone Health. Thank you so much for being with us, Doctor. First, as part of this announcement, Biden's team indicated that the cancer cells showed a Gleason score of 9. Help us understand what that means.
Yes. So a Gleason score is how we understand the cancer in terms of how it's behaving when we look at it under the microscope. So what was described as a Gleason score of 9, which tells us that the cells looked less normal. They did not look like normal prostate cells and more abnormal. And the higher the score, the more aggressive the cancer.
And with the cancer spreading to his bones, I wonder what challenges that presents for treating someone who's 82 years old.
Yes, well, there are lots of treatments. And in fact, it's not uncommon for prostate cancer to have spread to the bone. About 7% of prostate cancer patients are diagnosed with what we call metastatic cancer at the time of their diagnosis, which means that it's spread from their primary site, in this case, the prostate, to another part of the body. And fortunately, I can't comment specifically on President Biden's case, but in many instances, we can treat this relatively easily and gently with hormonal therapy.
And to that point, the statement indicated that the cancer is hormone sensitive. I wonder how that is determined and how that may shift the kind of treatment that he receives, what it looks like.
Well, what it looks like is in many instances, we know that prostate cancer can be stimulated by the hormone testosterone. And so we have various treatments that we use to decrease the production of testosterone, as well as block the ability of testosterone to stimulate a cancer cell from growing. And the hope here is really that we pay attention to quality of life. You mentioned his age, and that we try to really pay attention to how he can live well without too many toxic side effects.
I also wonder about how these diagnoses come about. This obviously comes only a few months after President Biden left office. How common is it to have such an aggressive prostate cancer go undetected until it spreads?
Well, to give you some broader perspective, over 300,000 men are diagnosed with prostate cancer every year. There are 3.5 million men living with prostate cancer in the United States. So it is incredibly common. And I think what's important about his being public about his diagnosis is that he had symptoms and he spoke to his doctor about them. And that's what led to this diagnosis. And so hopefully in this messaging, we can invite and make sure that men are talking to their doctors about any urinary symptoms that they have, any changes that they might have in their sexual function, if they have blood in their urine, and that this brings them to their doctor to have the appropriate conversations about what screening may be appropriate for them.
And to the point of screening, doctor, I understand that U.S. health officials advise against screening for men over 70. There are concerns about over-treatment and over-diagnoses. Do you think that that guidance should be reconsidered?
I think that every individual should have the opportunity to talk to their doctor about their personal risk factors. It's also about what age we start screening. So the average age we consider screening for prostate cancer is around 50, but in some instances, we know that we need to start screening earlier. We know that Black men, for instance, have a higher incidence of prostate cancer than other ethnicities. We also know that it's incredibly important that people are aware of their family history and bring that information to their doctor so that they can have appropriate screening based on who they are as an individual. And that may also include talking to your doctor if you're over 70 and if it may be appropriate for you. There's no perfect guideline for an individual. It requires a conversation with your doctor.
Dr. Elizabeth Komen, we appreciate the perspective. Thanks for joining us.
Thank you for having me.